And we do this every single Friday with Dr. K, Dr. Kevin Kavanagh. He is a retired physician. He's also the founder of a national organization known as Health Watch USA. And good morning to you, Dr. K.
Good morning, Jack. Good morning.
It's good to have you on with us, sir. This has become, we've talked about this a number of times. When I contacted you, whatever it was, February or March last year, saying, this thing's probably going to last a month and maybe even 6 weeks. Would you be willing to be on with us for that long? And you agreed to that. Now we're a year and a half later. And my question is this thing ever going to end?
Well, I don't know. We were able to snuff out polio and also measles. Those viruses were highly infectious, as much as SARS-CoV-2. And those diseases lasted for decades. And when we did that, about 90% of the population got vaccinated and followed advice. I mean, during polio and a polio season, people weren't going to restaurants, they weren't going to public pools or movie theaters. They abided by public health advice. And those infections lasted for decades, up until we had a vaccine. This infection, we similarly can start to decrease it and even at some point snuff it out. But we're not going to do that if only 50% of the people are vaccinated and we're protesting against using masks. This virus will continue to come at us. It will continue to mutate. It is so prevalent now it can recombinate, which means you get two different people with two different viruses. They get together, the viruses intermingle, and they swap DNA and get a supervirus. Much more problematic than just a random mutation. So we really do need to get a hold of this, but it means that people need to start following public health advice. And the schools, Jack, the schools need to get set up for the long term. This virus is going to be here to stay, and I really feel that we can get out of this. We have the knowledge to get out of this. It's just if we have the will.
When you say the schools need to get set up for the long run, are you talking about what exactly?
Well, we talked about this actually last August. We need to fix the school's ventilation systems to upgrade that, reduce class sizes. That's going to mean permanent hybrid learning. We need to test everybody in the schools twice a week. They do that in Germany. We did that for our sports teams. So it's not some liberal agenda if we're doing it for, the basketball teams. No one complained about that. We need to get the kids high quality masks, N95s or KN95s. I mean, that is just imperative, and they should be supplied by the schools. And of course, you need to sanitize surfaces and make sure that everything is clean. So this is just key. And then if we get community spread down, we could safely open up schools. There's no way you can do it when you've got a positivity rate that's approaching 13%, a very infectious and dangerous virus. It's even infecting kids that is rampant in the community. I mean, that virus, in my opinion, in an indoor setting will defeat a cloth mask given about 4 hours. So it's not a good situation. N95s or KN95s are the best type of protection at this point.
Now, the most common one that we see is the white on one side, blue on the other side. Don't know what those are called, but how effective are those?
Well, those are the surgical masks, and they're not quite as good as a KN95. The problem with those is the fit to the face. In other words, if you're breathing out the sides and the back with an aerosolized virus, it doesn't do much good. So they have to fit well. The CDC has a video on how you can tuck that and do the strap such a way that you get a better fit. Some people also will wear two masks or even a plastic holder over them to keep them better up against your face. So they're a okay type of an alternative, but my opinion, if you're going into a poorly ventilated indoor area, which at this point isn't a wise choice, but if you're going to do that, an N95, KN95 mask would be optimal. And to be honest with you, Jack, even goggles will help.
All right, here's a text. This is from Billy. How are we going to update the school's HVAC systems?
Well, it's going to require money. It's going to require an expert coming in and looking at room size, plus people that are in the room. Sometimes you can upgrade the central system. Sometimes you could bring in portable units, but portable units will also put a strain on your electrical system. But you can also put up ceiling UV light filtration and then have a fan to circulate air. One of the great things is in Kentucky, we have one of the leaders in the nation on this, and that's the Big Ass Fan Corporation. They have some really good fans with UV lighting that will sterilize air. And certainly in Kentucky, Lexington, get those in your gyms, your common areas, your hallways, your cafeterias, restrooms, all of that. And we're really not even utilizing the resources we have here in Kentucky. This type of planning we talked about last year. And people are saying, well, we can't do that for this year. That would disrupt the school systems. Well, we should have thought about that last August when we were talking about aerosolization of the virus. And I realized the CDC at that time was not talking about aerosolization, just droplet precautions, which takes much less effort to comply with. But to be honest with you, the mainstream scientists that were not affiliated with governments around the world, they were all screaming that this virus is aerosolized. We need to do more to stop it.
Let's go take a call here. This is Karen. Karen, you're on with Dr. K. Good morning.
Thanks, Jack. Dr. K, I just wondered, when we eradicated a lot of these viruses, why have we not been able to do that with, like, the regular flu when people take the flu shot every year? Can we not do something about that, or is it an entirely different thing? I'll hang up and listen, and thank you very much.
Well, the problem with the flu is that each year it mutates. We do kind of eradicate strain A, get the summer, goes away, and then you get a strain B. It mutates down in the southern hemisphere and then comes up to our nation. But one of the things that's interesting with COVID-19 and putting in these public health strategies, flu was all but eradicated in many, many countries. Singapore got rid of flu, they got rid of the adenoviruses, cold viruses. These strategies were very effective. So we can eradicate flu, but it does mean paying as much attention to the flu virus and airborne viruses as we do to pathogens that are in food or on surfaces. Now, when I say eradicate, I mean almost totally go away. Flu will probably always be around, and unfortunately, COVID will probably always be around, but not to the state that it is now, and to our society won't be as disrupted as it is now. But we definitely do have to get the levels down. And I hate to say this, Jack, but you don't do it by holding a state fair at the peak of a pandemic. It makes no sense.
Yeah. Let's take a call, then we'll get to some of these texts after the break. Bruce, good morning.
Hey, Jack, it's Bruce from way back. How you doing?
Yeah, good to hear from you, Bruce.
Just wondering why we are going into all these histrionics for a infection that has it's barely higher than the mortality rate for flu and lower than some flu years.
Oh, absolutely not. We haven't had 1 million people die of the flu in a year. And if you look at excess death data, which is the type of data you have for the flu, that's what we have with this. And also the narrative that we just need to look at deaths, that's really misinformation and disinformation. When you look at long COVID, the number of people coming down with this is going to be a very crippling pandemic, and we're going to see this wave after wave unless we start taking this seriously. For example, St. Elizabeth, they have a COVID survivor rehab unit right now that's up and going. You don't see that with the flu. You're also seeing ICUs filling, hospitals filling, and our numbers are still going up. So that is absolutely misinformation. And I think that you're going to find as our death toll mounts and people realize that it wasn't necessary and it just happened because of the information, for example, that you're parroting, that people are going to start to get very upset.
Well, I tell you what, how many of these deaths are not from a comorbidity? They're all actually being coded as a COVID death when in fact they had emphysema or they had cancer or they had high blood pressure or they had
Let me ask you this. I've got a severe healthcare problem that I need to get corrected with a surgery in Vanderbilt on September 15th. And that hospital's probably going to be filled. So I'm not going to be able to go there because someone wouldn't take a vaccine. So should I give up my bed because someone thinks that this is nothing and that we don't need to get vaccinated? Why should I do that? Why should I have to risk my life because people are parroting disinformation? And this is the same line of disinformation that Russia is doing.
Let me share some of these auto tech service texts with you. This one says, if these paper masks aren't good enough to protect us, why are our hospitals and clinics giving them out to protect while we're in their building?
Well, to be honest with you, I think they need to up their game. You'll find many people saying that, hey, we need to get N95s and KN95s. If everybody tries to get those, they may become in short supply, but right now you can still get them.
What's the difference between an N95 and a KN95?
KN95s are made to Chinese standards. N95s are like 3M, United States FDA standards. They're a little bit better, the N95s.
Okay. All right. Here's a question from Bill that says, what's the end game with masks and vaccines? This feels like this is a vicious, never-ending cycle.
I think that, yes, I think it will be endemic. I don't think that there will be an end game. I think when rates are low, people are not going to wear masks, especially on the outside, but still may do it when they get into an indoor setting. I think we're into a recurrent regimen of vaccines, but at this point, we need to get the mutation of the virus down enough so our pharmaceutical companies can catch up with the virus. As probably many people have heard, the vaccines are starting to have a significant number of breakthrough infections, and the New York Times reported that even some hospitalizations are starting to increase in those people that are vaccinated. As we've talked about before on this show, that's mainly in the group of people that are over the age of 60 and have been vaccinated more than 5 or 6 months out. That's according to the Israeli Health Ministry data.
What about boosters? They're talking about they could be out as early as September. Is that something that you feel like we're all going to need to get?
Yes, I definitely. Multiple data sets are showing that the vaccines are waning. The data which shows really rosy results with the vaccines are those that have only followed patients for maybe 2, 3, 4 months. But when we get to 5, 6 months, the Pfizer vaccine looks like it starts to fall off. The Moderna vaccine appears to maybe last longer because remember, that vaccine has about 3 times, actually over 3 times the amount of mRNA in it. So you're actually getting a more stronger vaccine and you may have a little bit more time to wait. Johnson & Johnson, they just don't have the data on that one.
I saw on Facebook or one of the social media sites someone that made the statement, and I really kind of appreciated it, and it made me again question why there is so much controversy over mask wearing. The person said, if I wear a mask, according to science, I have a possibility of saving someone's life and possibly my own life. If they are wrong, I just wore something over my face for the day. I mean, what the downside is, nothing's going to happen. I mean, the worst that can happen is nothing.
That's correct. You hear a lot of misinformation about masks. I know in Kentucky, I've read a couple stories about families that have asthmatic children and they don't want to have them wearing masks. But you read of stories in Florida, you've got families of asthmatic children that are petitioning the schools to mandate masks because normally the child who has asthma breathes fairly well between asthmatic episodes. They don't want them exposed to COVID or even allergens. I have asthma, and sometimes if I go into an area that is very high in pollen or very high in, for example, around horses or dander of animals, I'll wear a mask because it keeps me from getting an acute asthmatic attack. So masks many times help. And if you're in a severe enough condition that you can't wear a mask, you shouldn't be out and around people when the virus is this high and prevalent, because if you get COVID, you would be in severe conditions.
New Zealand locks down with just one case. What's that about?
Well, they're treating the virus very seriously. If New Zealand gets one case, they lock down. Australia is the same way. Singapore is the same way. They know the deaths and disabilities this virus can create. And to be honest with you, Jack, the disability is probably a far greater problem. Not that death isn't a horrible outcome, but the disabilities result in lifelong care to a large number of people. And we're seeing this in 10 to 30% of mild cases, much more commonly if you have to be hospitalized. And if you're in the ICU, I think you're probably going to be having lifelong problems. And so this is something that is of utmost concern. And if we're going to get back to normal, we need to start taking this virus seriously. Like the other caller said, he's comparing it to the flu. Well, the flu is a respiratory virus. This virus affects every organ of the body. Heart and lungs are probably equally affected. And some people, such as myself, think it affects the heart as much as the lungs. Many times,
Right.
heart vascular is asymptomatic. People don't know they have it, but yet symptoms will maybe develop and conditions develop many years down the line. And so we need to take this seriously.
All right, let's go back to the calls. This is Lori. Good morning, Lori.
Good morning, Jack. Good morning, Doctor. Listen, my problem is with the politicians that are trying to prevent the mask mandates and whatever effectiveness they can help us with. Greg Abbott, governor of Texas, tested positive. Okay, he's a wealthy man now. He can go to any medical care that's available. It turns out he is fully vaccinated, straight to monoclonal antibodies, and yet he wants to keep masks out of schools. That's not right. Thanks.
Well, I agree with you. I think we need to be taking this more seriously. I do think that there is a disparity in medical care between a lot of the leaders and people that have good access to the healthcare system. Monoclonal antibodies and getting access to that can be problematic. We had a tremendous amount of cases yesterday in the thousands, 4,800. You can't have 4,800 people get monoclonal antibodies in one day, but yet if you're a very high-ranking official, they get access to it. And so you'll see the senators and whatever, well, they'll get COVID and do quite well, not have any symptoms. Yeah, but they've got premier prime care, unbelievably good care. And so we need to really say, look, we don't have enough facilities to take care of all the patients with COVID. We may even be running out of hospital beds, which is one of the reasons why we need to decrease spread.
All right, we're out of time, unfortunately, Dr. Kevin Kavanagh. You have a great weekend. We'll talk to you on Monday.
All right, thank you, Jack.